Hi, I'm Dr. Alex and I'm a doctor of chiropractic. I often get asked about disc herniations, what they are and what my patients can do themselves to improve their situation. So what is a slip disc? With the exception of the first two vertebrae in the neck, the atlas and the axis, there is an intervertebral disc in between each vertebrae of the spine. Discs act as a shock absorber and shock distributor and provide a flexibility in our spine. So think of the disc as a cushion for your spine. So here we have a close-up of the spine. So in the middle here we have the discs. This is the vertebrae or the bones, and in between them we have the nerve that passes throughout. So the discs are made up of the annulus fibrosus, which is the tough outer layer, and the nucleus pulposus, which contains a soft gelatine-like center. When cracks occur in the outer layer of the discs, the material inside of the disc can begin to push out, and in most cases backwards towards the nerve. Numerous factors can cause a disc to herniate. For example, there may be too much stress on the disc due to poor posture or from being overweight, for example. In fact, a herniated disc can be caused by a combination of factors or physical injuries. So as the inner material of the disc leaks or bulges out, it puts pressure on the nerves that run through your spinal column. Typically, the spine will put more pressure on the front of the disc, which pushes the disc and herniation even further backward. This is what causes your pain and other symptoms. The specific symptoms that you experience will depend on the location of your disc protrusion, but some of the most common symptoms are pain locally in the low back, numbness, tingling, and weakness. Because of the way your nerves branch out throughout your body, these symptoms are often felt in the limbs. So what can you do if you suffer from disc herniation and you want to improve your situation? Firstly, consider consulting a professional healthcare worker who is specialized within the musculoskeletal system, such as a doctor of chiropractic or physiotherapist. They will help you set up an individual treatment plan that is suitable to your situation. In the meantime, I want to go over a very useful exercise that will help treat disc herniations. So the exercise that we're going to do that is going to help you with your disc herniation is an exercise called the Mackenzie. So as we know, with disc herniations, typically more pressure is put on the front of the disc, pushing it back towards the nerves. So with Mackenzie, what we're going to try and do is we're going to try and do the opposite. So we're going to put more pressure on the back of the disc, centralizing the disc a little bit more and pushing the disc herniation forward away from the nerves. So the way we do that is that we apply a prone position. So in this position, what we do is we want to raise our upper body up, but only allowing movement in the lower back. Try to push up as much as possible, being as relaxed as possible in the lower back and glutes. What a lot of people do wrong is that they'll start lifting the bottom and pelvis off the floor. And that is not what we want to do. We want to make sure that all the movement is made in the low back. So what you can do is you can imagine that you have a tight strap that is pushing and holding your pelvis in place against the floor. So again, what we want to do, we push up, only allowing movement in the low back, hold for 8 seconds, and then slowly lower your upper body. And then we go up again, as much as possible, hold for 8 seconds, and then slowly go down. And this you can repeat 10 times, and it's good to try and do this every other hour. So if you can implement this exercise on a daily basis, trust me, your discs and your spine will thank you for it.